give it a minute. At least it's a nice sunny day out right now until tomorrow.
I don't know. I don't think it's going to be that big.
Fingers crossed.
I don't think
right?
it is. Because
my goodness.
all their predictions are from now until Saturday. I'm like, it's a very
That's what I heard on the. I was like, until Saturday. When did that happen? But anyways, fingers
But it's
crossed.
not that much snow over
just
a
needs to
4-day
be
period.
True. Yeah. It just needs to be spring at this point, though. All right. Well, welcome. We are here at Colchester, the very new Colchester Veterinary Clinic. You may hear some stuff going on in the background while we're talking because they are in the mad dash for the finish line. Yeah, that's right. So officially opening their doors on April 8th. Here at 190 Industrial Avenue. Just a reminder, of course, that our newsletter comes out tomorrow. And if you haven't signed up and would like to do that, you can head over to trobuzz.com and sign up, and it will come right to your newsletter, to your email tomorrow morning, filled with events in Colchester, so you don't have to go looking. So as I mentioned, we are here with Dr. Karen at Colchester Veterinary Clinic. So Karen, why don't you introduce yourself to our viewers and tell a little bit about yourself?
Sure. So I'm Dr. Karen Johnson. I live just outside of Truro, and we've been here since COVID, which is not an ideal time to move, which is what I tell
but so many people did it.
Exactly. So I am originally from Chester, Nova Scotia. That's where I grew up. I graduated from vet school. I have lived kind of all over the world. I've worked in Australia as a vet for several years, doing large animal there, and then I moved back home.
Wow.
I've been working in Ontario as a vet, where I had my daughter moved back home to be closer to grandparents.
Of course, you have to do that.
And then most recently I've been working out of New Glasgow at East River Animal Hospital, and then decided that I would do something I said I would never do and open my own vet clinic. So here we
It's funny when you hear that about like owner operators, entrepreneurs. It's like a lot of the time they're like, never in my wildest dreams
was adamant.
ever
Never. And here we are, a couple of days away from opening, in the mad dash to try to get everything done.
It'll come together though. Yeah. It will. Yeah. If you have any questions, please let us know and we'll read them out as we go. So Karen, can you tell us a little bit about the inspiration behind opening Colchester Veterinary Clinic and maybe what sets it apart from other vet clinics that you've had lots of experience working in?
For sure. This clinic is definitely, I've taken the bits and pieces that I love from other clinics that I've worked at and brought them together in kind of my vision. I want a clinic where we do as much as possible to encourage people to bring their pets in so that it's low stress. I think one of the biggest things why people don't want to bring their pets in is the fear of how their pets will be affected by their visit into the vet. So that's a big thing for me. I am 16 years out of vet school, so I've been doing it for a while. And I wasn't that young when I graduated, so I just wanted to make something that is my own.
Yeah.
I've had a lot of bosses. I've had a lot of very great bosses. One of my big inspirations, I don't know why I'm being sad about this, probably because I miss her, is Dr. Christina Hughes from Sackville Animal Hospital. She is a fantastic boss and leader. And then Dr. Mike Fife in Ontario, who is actually opening his own new practice
amazing.
Next in a couple of weeks. Another one. He was a very good mentor for me. So I'm trying to take things, make it my own, and make a low stress environment for pets, but also a really good environment for staff.
Yeah.
One of the big
important
issues in veterinary medicine and elsewhere, but especially in veterinary medicine, is burnout. So people always ask, why are there no vets? Why is there no staff? Because people have left.
Right.
So this is my opportunity to try to build a team of like-minded people so that we have a safe, healthy workplace for people and then be able to provide better care.
And when you have that kind of environment, obviously your patients end up getting better care as well.
Exactly.
So yeah, what a great business to have opening here. So can you tell us a little bit more about the specific services that pet owners can expect to find here at Colchester Vet?
Yeah. Our main focus is prevention. We don't want your pets to get sick. We want your pets to be around for a really long, healthy
Right.
life.
Unfortunately, it happens.
And unfortunately, it happens. So our goal is to get your pets in on a yearly basis, do our yearly exams, make sure that we're catching things early before they become big issues. So that is our main goal. So we have our annual wellness exams. We have our vaccine appointments, which are also getting your pets vaccinated is very important to prevent disease, especially because Nova Scotia seems to be a great area for disease, Lyme disease, lepto disease.
Right?
Exactly. Exactly. But beyond those regular health appointments, surgeries, so routine soft tissue surgeries, anything more advanced, we refer into Coastal Care referral center that's open in Bayers Lake. That's one of the new referral centers that have opened. But soft tissue surgery, so your routine. I say routine, but our spays and neuters, things that people think of as routine, are dental procedures, so cleanings, extractions for those teeth that need to come out.
Very important for animals as well.
Yes, dental health is super, super important, and we do talk about that a lot here. Amputations, limb amputations if they have to happen, eye enucleations, splenectomies, abdominal surgeries, those sorts of things that we will do here. But the more specialized things like orthopedics especially will be referred.
So very full service.
Yeah, very full service.
Absolutely.
Yeah.
So Karen, can you tell me a little bit about how your team prioritizes the well-being? I mean, it's something you mentioned already numerous times, and comfort of the pets that are coming in for their visit.
Yeah. So we always try to pre-screen appointments, asking clients, how does your pet do coming into the vet clinic? If there's a lot of anxiety, aggression, anything like that, we strongly encourage pre-appointment medications, which we're happy to dispense in advance of the appointment for pets to come in. It makes a huge, huge difference.
For the pet and
the owner. Everybody. Yeah. Exactly. So that's one thing. We are going to be, as soon as construction is done, feline friendly. So we have a dedicated cat room. So especially for our feline friends coming in, they generally don't want to be around dogs. So it's getting them to come in the front door right into the cat room.
Oh, that's amazing.
And so that's going to be part of being feline friendly.
And I've seen in your exam room, you have the little cat hammock. It was
for
so
cats.
cute.
We have stairs going up the walls for them. There's the window in the cat room as well.
Amazing.
So they can look out there and watch the birds. And that will be great for them. So it's really just trying to get animals in, limit the amount of time that they have to be here. So that's another thing, being prompt for our appointments is very important to us. Not waiting around a lot, and just gentle handling is a big thing.
Fantastic. Again, if you have any questions for Karen, let us know. We'll read them as we go. So Karen, you already kind of stressed the importance of preventative health care for pets. How will Colchester Vet address this? I know you had already said you have your yearly appointments and that kind of stuff.
Yeah. So recommending wellness blood work. It's really important to try to catch things before your pet becomes very sick. It's a lot.
I mean, as in animals, human, anyone. The sooner you catch it, less expensive, less everything it's going to be.
That is a big thing. We are all crunched. I use this example every day of people asking why is it so expensive. 3 years ago, a bottle of olive oil cost $6. Now it's $24. So costs have gone up. So also having the talk with clients about pet insurance. We don't sell insurance. We have nothing to do with insurance companies other than we can submit claims. So if you have pet insurance, which I do on my pets, it's a little bug. It's spring. The bugs are back.
I guess so.
Having pet insurance to help with costs, or having some sort of plan to help with the unexpected events. But vaccinating your pets, like we've talked about before, Lyme disease is so prevalent here. I see it all the time. Being on flea and tick prevention. There's other tick-borne diseases that we need to worry about other than Lyme disease. So,
and I think that's important to know too, because I feel like Lyme disease is, everybody hears about it so much. Right, exactly. That's what they're worried about. But there are other
diseases
that may come
that
with
the ticks are carrying here in Nova Scotia, and they're becoming more and more prevalent and causing a lot more issues. And we're seeing it in the human population too. So all those sorts of things, it's all about prevention.
Right, of course. Yeah. And we mentioned dental as well. Dental health affects so much other things in the body. So having, making sure that's something that's well kept as well is so important.
Absolutely.
So could you explain the significance of digital imaging in, speaking of dental care, for pets and how it benefits their overall health?
For sure. Yeah. So we have digital dental x-rays. So taking dental x-rays is standard of care here. Everybody gets dental x-rays as part of the package that we go over with clients. You can't, it's for teeth especially, it's like an iceberg. I can tell you what's going on for what I can see, but almost 100% of the time, what's below the gum line is a completely different story. So that helps us decide what teeth we can keep, what need to come out. And I've had so many clients tell me that their animal, pre-dental and post-dental, they're completely different.
Wow.
Because they're not in pain anymore.
Right, of course.
So that's dental x-rays. We have our full main digital x-ray unit for doing all the other x-rays that we need. As a vet or as a doctor or anything, you're limited by palpating, listening. We can't actually see what's
They can't tell you what's wrong.
Well, yes, so pets can't talk either. And generally, they hide their pain and everything very well. Because again, as I tell clients, evolution, if you show that you're in pain or afraid, you get eaten.
That's that's how it is.
So that's how it is. So the dogs and cats, if they are showing us pain, that is really significant. Right. So and the benefit of dental x-rays is it's immediate. Like people are always surprised. We all know what it's like going into a hospital these days or waiting for things to get done, having your requisition to get blood work. You wait 3 weeks.
Everything takes forever.
Everything takes forever.
It really does.
So I think that one of the great benefits of a veterinary hospital is we are full service with all those things with the dental x-rays and the digital x-rays that you get answers within minutes.
Absolutely.
Unless, and as a vet, I am a general practitioner. We are all general practitioners in our individual practices. There are some things that you have to send off to a radiologist for them to interpret for you because they're so slight changes that we just may miss. I can see a broken leg.
Right. Yeah, of course.
That's obvious. But some things might take a couple hours to get back again. So that is fantastic. We have our ultrasound machine here as well for just kind of our fast scans. If at the moment, if we need more in-depth abdominal scans, that sort of thing, then again, that's a referral process. But referrals in our veterinary medicine world happen a lot
quick,
faster compared to the human world.
I mean, so what it comes down to is you guys are really trying to do as much as you can here to get people the answers as quickly as you're possibly able to.
Within that day or the next day.
Amazing. That's fantastic. So I know you did already mention a little bit about the surgeries that you're going to be doing here at the hospital. Can you maybe elaborate a little bit more on those and let our viewers know how you ensure the safety and comfort of pets undergoing those procedures?
For sure. Yeah. So that's the big thing. And I kind of alluded to this at the beginning when I said routine space and neuters. Right. So just to clarify, there's no such thing as a routine surgery.
Right, of course.
You're making cuts into the body, and that's not routine. So you always want to minimize your surgical risk and your anesthetic risk. So there's always a risk of death.
Right.
That is just the way it is. So to mitigate that, our older animals have to have blood work prior to surgery and anesthetics. The younger animals, it's optional, although strongly encouraged. I have seen animals, 6-month-old dogs coming in for space and neuters that you run blood work and surprise, they have congenital kidney failure that you would not have known about, and that animal would not have survived that procedure if we hadn't run that blood work. So that is one thing that is offered. All of our animals are monitored for the entire procedure by a registered vet tech or an assistant in conjunction with the veterinarian. So we have our real monitors with ECG and temperature and pulse and respiration and end-tidal CO2, like all the bells and whistles with our brand new monitor, which we have to learn how to use this week, along with everything else.
There's a lot going on.
All of our procedures, unless it's an emergency, are done in the morning. So then they have the whole afternoon with us for
lovely.
recovery.
Nice.
They're all on heated blankets for the procedure, so their temperature is maintained. They're all hand recovered by our staff and monitored. And again, if there are complications post-surgery, then that discussion will be had with the client of this is what's going on. Likely we will recommend transfer to a 24-hour facility for continued monitoring. There's no point to keep an animal in a hospital overnight that's not staffed. I would never want my animal in a hospital overnight that no one's watching them.
Yeah.
So for me, if I'm recommending referral, there is a reason behind that. And that reason is the safety and health of your pet.
100%.
That is the only reason for me of all of my recommendations. It's what is best for your pet. And, you know, if that's not something that you can do, then we'll talk about it and we'll come up with other solutions. It's not cookie cutter here. I have people ask me, what do you do for this situation? I'm like, it depends on the owner.
There's so many different variables.
On what's going on.
That's right.
It's not cookie cutter. Medicine never is. It's always evolving, and you always have to change with what happens.
Of course. Yeah, absolutely. So, I mean, what it really comes down to is that you guys are going to be doing exactly what you think is best for the pets. And if that means doing a referral, then that's obviously what you're going to do. If it's doing blood work, that's what is going to be communicated to your patient. Yeah, absolutely. So how does Colchester Vet Hospital support pet owners in making informed decisions about their pets' healthcare needs?
For sure. It's education. So anytime we talk about anything, or if we diagnose something, you're always going to be sent home with more information to follow up on. One of the different things that I'm doing at this clinic is everything is cloud-based. That's our world. We all live in the cloud now. So everything is emailed to you. You have a permanent record in your email. We have a pet portal that clients can go into. They can see their history.
Oh, that's awesome.
So it's great if you are referred and your regular vet isn't open. You have a record online of what your pet has been going through, what meds they're on, that sort of thing.
It's not something that the patient has to kind of come in and try and remember.
Exactly. You never, like I hear a lot of times they're on the white pill. I don't know what the white pill is. Or they're fed the purple bag of food. I don't know what the purple bag of food is. So it's a place that you can have all that information in together. But it's all about, I have a discussion with the clients and I try to explain everything that we're doing. That's very important for me. And if you don't want to know everything, that's great too. But it's always having those conversations of this is what's going on. This is what these tests will give us. If we can't do those tests, then this is our other backup plan. Estimates are given every single time. There's never surprises financially. That is gone over at every single appointment. I don't want to go into my mechanic and come out with a $2,000 car bill. I don't want you to come in here and go home with a $2,000 bill. That will never, ever, ever happen. So that's kind of how we want to inform our clients. Of what's going on.
I mean, the more information, obviously, the patient and the client has, the better they are in being able to make the decision on how they want to go forward.
And that's really important. So as your vet and as a vet, I don't make decisions for the client. I try to give you all of the information and you get to decide. And if you don't feel like you have enough information to make a decision, then we keep talking about it. But ultimately, the pet parent is the owner of the pet, and you need to make the best informed decisions that you can for your pet. I can just tell you what our options are. And then go from there kind of as a healthcare team. It's the guidance.
Yeah, absolutely. Yeah. I mean, obviously this is really important to you. You've mentioned it already, but what measures did your team take to create a low stress environment for both pets and the owners during their appointment?
So again, it's having the feline friendly section. Once we get started, we are also as a clinic going to be working towards fear-free certification.
Oh, amazing.
So that's a separate program that was set up several years ago that it started out as individual certification. So I'm certified fear-free. 2 of my staff have already joined and they are already certified as fear-free. So the majority of the staff here have already learned those techniques of how to handle, restrain, approach, all of those things to help decrease fear and anxiety in our pets. We've all been trained in recognizing the signs of fear and anxiety in pets, and then how to mitigate those. We also, and this is really exciting for me, and one of the main reasons why I chose this building, the location used to be a restaurant.
Right,
I've heard this many times. So there is a great deck.
Old Road Barbecue, actually.
Exactly. Yeah. I never came here for that, but I've heard that many times.
We do miss them if you happen to be watching, but yeah.
I've heard that a lot as well. But there's a great deck that's built off the side. So what we are going to offer is outside appointments for those dogs that don't want to come in. I won't see a cat outside because I'm not going to risk.
There's a lot of woods and industrial stuff.
Yeah. So for the dogs, we're going to have an outside area. I see a lot of farm dogs, especially those Pyrenees dogs that literally
they don't go inside.
Yeah. The floors literally scare them because they're slippery. So we'll see pets outside to help.
Amazing.
Not if it's pouring rain.
Yeah.
But we'll try to arrange
some exceptions apply.
Exceptions. But it's those sorts of things. And I think probably what a lot of clients don't recognize too, and this is why we're having the open house too. I want people to see the back area, because
I even said it myself when I came back. I was like, I had no idea that it was so big.
So we have lots of open spaces so that the animals don't feel cornered or anything like that. But sometimes animals are actually better away from their owners. And we're not doing anything terrible to your pets out back, but sometimes, and this is a very natural thing, pets are very special. And I'm really talking about dogs. They're very protective of their owners. So having me approach them in a room where they're sitting in front of their owner guarding them is not a good situation. And it's a lot of times very easily fixed by just taking them away from the owner. And you can actually see the behavior change completely. They're more relaxed, they're more comfortable, and things just go a lot more smoothly and quickly, because it's our goal to get you in, see you promptly, minimize the amount of time that you have to spend here. Everybody has other stuff to do.
That's right.
And then get you going on the rest of your day. And we really, I feel like we saw this highlighted during COVID when people couldn't come in to the clinic. When we were an essential service and we were just trying to stay open, and those pets that we had been dealing with for years with a lot of fear, aggression, then we had the opportunity where they were away from the owners, and we saw that change.
Oh, wow.
And that's where I think it really highlighted us. Now, that being said, there are some pets that do a lot better.
Yeah, right, of course. So, it's a pet by pet basis,
100%, obviously. Not cookie cutter. So, I've had a lot of clients say to me, I've never had anybody be able to touch my pet before, and you're right there on the floor. So that is another thing. We have exam room tables. I very rarely use them. I'm on the floor with your pets, which is a lot more comfortable for them as well. I have seen clients, because this is what a lot of people do. German Shepherds up on the table. Like, what are we doing right now?
That dog's like, what is going on? For sure. Absolutely. That's amazing. Those are sound like amazing measures that you guys are taking. It really shows how much you care about the well-being of the pets and the owners. It's fantastic. So tell our viewers how pet owners can best prepare for their first visit to Colchester Veterinary Hospital.
So we have a lot of people who are already pre-registered, and you can pre-register and then continue to register your pets through a link on our website. So that's just giving us the information. Because we are cloud-based, all of our reminders and messages and everything go out by email or text. So when you get registered through your pet portal and you can book your appointment, you get a lot of forms to fill out.
Of course.
Just with extra information. And in a lot of those forms, there are questions about, is your pet afraid of coming to the vet? And that flags those for us to then call and say, okay, let's talk about this. What can we do to mitigate it? Have you tried medications before? Do they need to be seen outside? Like, what can we do to make this a better experience for everybody?
Again, the more information you have.
Exactly. And we need that information, because we have never met anybody before. It's all new clients.
Brand new,
all new clients. And I get that question a lot too, of, are you accepting new clients? Because I know that is kind of the situation for the past several years of not being able to get a vet. And the answer is, of course, you're all new. We're brand new.
Everything is new.
Just pre-register and we can book you in. But yeah, with these forms, we'll get those, and then we can talk about, like, do we want medication? Do we need to book you at a certain time of day as well when it's less busy? Or does your dog or cat need to go straight into a room or do we need to come in the side door? All those sorts of things will help make the appointment better for everyone.
Sure. And they can pre-register on your website, which is
colchestervh.com. So Colchester Veterinary Hospital, but it's just colchestervh.com.
Right.
And right on that main page, there's a pre-registration link that you can send all of your information. We create your file. You'll get a text message back saying that you're now active in our system. You can go back to our webpage and click on the pet portal link. That takes you into your pet portal link at that point, which you'll see all of your pet's information and your information. You can request appointments through the pet portal as well.
Oh, wow. Okay.
And just kind of give us general ideas of, like, morning, afternoon, Tuesdays, Thursdays, whatever works best.
It's quite easy to navigate.
Yeah. Oh, good. I'm glad. That's
I had a look through it. Yeah, absolutely.
Yeah.
So can you mentioned, but can you tell more to the viewers about the open house that's happening on April 6th?
Yes. So
and what attendees can expect?
Yeah. Well, you get to meet me.
Awesome.
So there's definitely clients that have pre-registered I already know, which is really great to continue to see people. But you get to come in, meet me, meet my husband, meet my daughter, because they will be here.
Of course,
I'll be with that as well. If the staff are available, they'll be here too. But the main thing is take a walkthrough.
Yeah, come in and have a look.
See where your pets are going to have surgery.
Yeah, exactly.
See the dental room. See where the cats are kept. So in the back, the cats have their own kennel room, separate from everything, so it's quiet for them.
Amazing.
The dogs have their own room. You get to see treatment. You get to see the equipment that the dental X-rays, the digital X-rays, the lab equipment, all of that, and just have a look and have some cake.
Yeah, of course. I think that's just such a great opportunity because, I mean, so many other vet clinics and vet hospitals are already established and ready to go when you've already taken your pet there. So the only parts you're seeing are the parts that your animal at that moment has to use. Yep. So being able to come and kind of take a walk through and see all of your guys', state-of-the-art equipment and what it looks like, I think that is such a great opportunity. So it's April 6th from 1 to 3, correct?
1 to 3, yep.
And at 190 Industrial Avenue. So make sure you kind of mark that in your calendar and pop by to see everybody.
And the storm should be done. I know there's a lot of concern about the storm, but it should be fine by 1 o'clock on Saturday.
We're like putting it out in the universe that it's not even going to happen. So, Karen, can you share any success stories or memorable moments from your journey as a veterinary medicine that kind of embody the mission of Colchester Veterinary Hospital?
Oh, well, I mean, any success story of those pets that you don't have a lot of hope for, and then they just hang in there.
Right.
And it really, if you give them a chance, a lot of them can do miracles. I think the big thing in vet med is you can't save everybody.
Right,
and that is hard.
I cannot imagine.
A lot of us.
Honest to God.
And I do get the comments, especially when we're dealing with end-of-life situations, about how that must be the worst thing that I deal with. And it's actually not.
Right.
It's actually it's just not great, but it's actually one of the better parts of our profession that we have a way to end suffering. So that's really good. But I've had a lot of, you have C-sections, so you get to deliver those puppies that get stuck and may not have met the world otherwise. There's just so many different cases, and it's not really my success. It's working with those clients that just listen and say, yeah, we're going to do that.
Right.
Yeah, we're going to go and do that. And then something that probably I may not have by myself been able to help, but with using the whole veterinary team, come out the other end, and you get to see them for years and years and years.
Oh, yeah.
Afterwards.
And I'm sure building that relationship with patients that, like you said, are, you're seeing year after year is really special.
It is.
Yeah.
I mean, I have to say I have met a lot of clients at end-of-life appointments, and then that has created a bond, and then you get to see them with their next animal, and then see that animal grow up, and then kind of repeat that cycle, because our pets aren't around long enough.
Right.
We all wish that they could be here longer.
You know we do,
yeah. But it is seeing animals grow. I mean, time passes so quick. I'll see a puppy, and then all of a sudden it's a year later. So I'm like, "What? You were this big the last time I saw you, and now you're this big. What? It's been a year." Yeah.
Animals and kids, right?
Kids, yeah.
I know. It's so true. So what advice would you give to pet owners to ensure the long-term health and happiness of their furry companions?
Yeah. I think it really is those annual wellness exams.
So important.
It's the only way for us to catch things. And a pet's lifespan is very short. So when we're looking at humans, you can go years between seeing your doctor and nothing happens. But as pets age and you go a year, a lot of different things.
When they age so differently,
yes,
then
they do. Yeah. So a lot of things can change. Things can change even within a month. I mean, you can have a perfectly healthy pet, and then 1 month later, you can have a not perfectly
As anyone that has had a pet and, unfortunately had to have something like that done, like, I'm sure you probably hear so many times, like, yesterday he was fine.
Yes.
Yeah.
Yeah. And that's usually what happens. I mean, generally things happen very quickly, especially because, and we've talked about it, our pets hide things really, really well.
Yeah.
And it's hard when you're at home with your pet, because you probably are seeing just very gradual changes. And so coming in for those exams with your vet, I am not seeing your pet every day, and I can see that stark difference pretty much immediately, and then talk about it and go from there. So coming in, having your exams done, listening to the heart, listening to the lungs, looking at the ears, the eyes, feeling the abdomen, feeling the joints, feeling your lymph nodes. That's your biggest benefit of a hands-on exam by a veterinarian to try to start to figure out, is there something I need to be concerned about?
That's great advice. Absolutely. So last question before we sign off. As the owner-operator here, what are your hopes and aspirations for the future of Colchester Veterinary Hospital? I know, it's probably like...
Okay, so first I said I would never open a hospital. So here we are with that. My hope for this hospital, so there is, and people ask this, there is just me as a vet now, but I would hope to grow to a 3-vet practice.
Sure.
Be able to expand our offerings. I would love to start offering rehab services here. More and more people have pet insurance, so more and more people have the money to do those orthopedic surgeries, those things that need the rehab. So being able to provide that so people don't have to drive into the city, because it is a time commitment. An hour isn't that far to drive. But if you have to do it all the time, it does add up. So trying to add that in is one of my goals. I would love to, then this is 10 years down the road. This is not 5 years down the road. Future plans. I would really, really love to open a 24-hour clinic in the Truro area. I think we all know that we have the HRM and there are those services there. And, taking again the hour, taking your pet in there, that's great. They have those services, and as a pet owner, that's where I would take my pets as well. But to start having those services outside of the city center, having it in Truro, it's better for the people, like even in the New Glasgow-Pictou area, and it's even closer for people up in Cape Breton, which are really suffering right now for those types of services too. So I hope. We have to see what happens with life.
That's right. Yeah.
Life never goes as planned.
No, so it's true. But that's amazing to kind of know and see what your vision is, and, fingers crossed, right? That kind of stuff happens. Yeah. So, well, thank you so much for having me. Honestly, it's been amazing to come and have a look and to hear all the amazing things you guys are going to do. And, sitting here having this conversation with you, I can really feel and tell how much you care about what you do. And I just think this is going to be a great addition to the Truro area. So that's amazing. Thank you so much. Enjoy the rest of your day.
Thank you.
See you guys.
Bye.